Hi there. Do you mind starting by telling us who you are?
I'm Kenechukwu Esom. I work with the United Nations Development Program as a policy specialist focusing on human rights, law, and gender. I work specifically with the HIV health and development team.
One of the things that's been really hard, I think, for everybody is how COVID has affected us all personally, right? So that it's not only about out there, it's about all of us as well. And I just wondered if there's anything in terms of your world where COVID has affected you personally that you wanted to talk about.
Besides the weight gained, right? But definitely, I mean, I live in New York, and everything is wired around specific timelines. We have a child, so childcare definitely has been affected. Been working from home since March. My partner works in healthcare, so the constant anxiety of what could happen as she's involved with treating people with COVID and not being able to see family and friends. So there's a whole layer of how COVID affects one personally, but vicariously also as you worry about those close to you and what it might mean for them.
And what about in terms of your work? I mean, in terms of UNDP, COVID changed kind of the arc of the work that you're doing and also how it's affecting the communities that you work with most closely.
Broadly within UNDP, because of the development focus of our work, most of my colleagues, I mean, with the advent of COVID-19, much of our work began to focus on helping countries with the crisis as it took its toll on countries and on various development programs that were already ongoing. And that has been the thrust of UNDP's broader work in this area. It also has significantly impacted the way we work. Working virtually has its upsides, as we've learned in this year, but also its downside. We could hold interactions with people across geographic space in ways that we couldn't before. But on the downside is that oftentimes the interactions that happen as a result of policy making, things that happen on the sidelines of events, which is where you get to explain issues and hear feedback from your counterparts, and then directly address key issues that are often not verbalized in collective spaces like that. That bit is lost. We also work with key populations, including transgender persons, men who have sex with men, sex workers, whose lives and safeties have been severely impacted in many contexts, especially in context of criminalization. And then, of course, disruptions on treatment, prevention, essential services, and what that has meant for the HIV response. So, yes, it has had a significant impact on the communities we work with.
And I know that you were doing some work where you're actually looking at the impacts of COVID policies. And maybe, could you say a little bit about that and maybe particularly the area or the focus of policies you think are most of concern?
We began to look at how countries were responding to COVID-19 through legislation. And this was very important for us because in working on HIV, there's been a huge jurisprudence around how laws impact effective HIV responses. And so we got very alarmed as we saw that countries were using legislation and oftentimes replicating the sorts of provisions we saw in the early days of HIV. In the early days of HIV, very little was known about the virus, the character of it. There was a lot of fear, suspicion. We saw laws that criminalized people who were at risk of disease, and those laws then impacted access to treatment, access to service. It had impact on stigma and discrimination and just all kinds of prejudices. So when we began to see countries respond with laws that criminalized people's refusal of mandatory testing or people's infraction of lockdown measures. And oftentimes these lockdown measures are so inconsiderate of people's personal situations, implications of these lockdowns for various categories within the demographic of a country. So the punitive response to the pandemic was something that really ticked us off because we had seen the impact on HIV. And so together with a few other partners, we began to collect the text of these laws to be able to see what they contain, to be able to see what human rights were directly implicated or inadvertently implicated by the way these laws were being enforced. And it's quite interesting, hopefully with a view to advising countries to reform some of these laws as new information becomes available on the nature of COVID-19. And at a policy level, I think one key issue is how responses might impact on the rights of populations, and to make sure that COVID-19 responses tailored to the realities of different groups and different populations. There can't be a blanket one-size-fits-all response. We've also seen an uptick of the use of digital technologies in ways we hadn't seen prior to this year. For all the benefits and the potential that digital health technologies present, we also know that it could perpetuate social biases, prejudices. It could have severe impact on the right to privacy, on confidentiality of health, personal health records. So it's also important that we use this opportunity that COVID-19 presents to support countries and stakeholders at country to make sure that the use of digital health technologies are driven from a rights perspective, that countries are not abdicating their responsibilities and their obligations under international human rights law. As we begin to look at vaccines and the possibilities of its rollout, we have to think about access and what this means for low middle income countries as richer countries begin to amass high volumes of the vaccine for their populations.
And even within whether lower middle income countries or higher income countries, also the differences amongst the populations and making sure that everybody.
Absolutely. And we already saw those decisions being made with ventilators, and we should just ensure that the policies put in place a system that is fair, that doesn't deepen inequalities within and across countries.
Are there things that have been happening that you see governments doing, or the UN doing actually, that seem to be really moving us in a positive direction in the context of COVID?
COVID-19 has provided an opportunity for countries to rethink incarceration. We've seen people, the decongesting of prisons. We're seeing countries begin to realize what a number of us have been saying for a long time, that, mass incarceration of people for the most simple offenses is just not the way to go. Many countries actually took measures to release people from jail and prisons who were serving time for really, really simple offenses. And we're hoping that this is the way to go, not just as a public health imperative, but as a human rights imperative. So that's one really good example. Yeah.
And that's a really good one. I mean, that's a really positive one. When you think about us as a society, and you think about this experience and the way that we've all lived through this very locally and very globally, what do you think are like some of the key lessons we need to keep in mind as we move forward to whatever the new world is going to be?
There are a few things we've seen. Whether we've learned the lessons, it's a completely different question. We'll have to look to see. But, just how interconnected we are. And in the global health space, we've previously seen how certain diseases have been neglected because they affect certain populations and not other populations. And we have seen how those determinations around cost effectiveness have prioritized research, and development of treatment, vaccines, etc., around certain diseases and not others. COVID-19 shows us what's possible if we really prioritize a health situation, a public health pandemic like this, and it begins to call to our minds the question of why we haven't done as well as we should with other diseases, and hopefully, and that's why I say I hope we did learn something. Hopefully, COVID-19 forces us to say this is possible for tuberculosis, for a number of neglected tropical diseases, and even for whatever will come our way tomorrow. I think also COVID-19 has really laid bare how susceptible health systems are even in the most advanced, supposedly developed context, this has to be constant work in progress as we rethink what effective health systems should look like, the effective community systems to support health systems should look like, effective policies and laws to uphold this, and just broadly the social and structural determinants of health and how we look at them. And it takes something as highly impacting as COVID-19 to show us that.
So, Kenny, thank you. That was wonderful. Much appreciated.
No, the pleasure is mine. Thank you.